It's lifestyle medicine. Keep you dancing. Ooh, 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 ooh. With Dr. Jengyu. Dr. Jen is a doctor of I can't say podiatric. He's a podiatrist. In addition to completing a biomechanics research fellowship and I can't say that word. Podiatry, thank you, orthopedic residency at Des Moines University. He's also an NIH fellowship in physical medicine and rehabilitation at the world-famous Mayo Clinic. Dr. Lai emphasizes an integrative approach to treat and manage the lower extremity problems. He also focuses on applying lifestyle medicine, the lifestyle medicine principles to assess and treat root causes of common lower limb conditions. Currently, Dr. Lai practices at the Rochester Clinic and is a certified physician wound specialist, a CHIP facilitator, and diabetes prevention program coach. Dr. Lai.
Thank you. Good morning. Oh, a little bit nervous here. As Denise mentioned, I did my fellowship at Mayo. So one of my fellowship mentors right here, so I'm a little bit nervous, even though I finished my fellowship 20 years ago. So today first of all, if you think that I'm going to teach you how to dance, sorry, it's a little bit misleading. We're going to talk about the feet, how the feet is related to lifestyle medicine, and how the chronic conditions are affecting your feet. So that's what we're going to talk about today. I'm going to talk about how the feet are important in maintaining a healthy lifestyle. And at the same time, I will give some examples on the most common chronic condition in the foot and ankle and how the lifestyle medicine approach can help them. So first of all, we'll talk about podiatry. People talk about the feet, the toes, the nails, but according to the statute, podiatry in Minnesota is everything distal to the tibial tuberosity. So if you don't know what it is, it's a lump underneath below your knee. So everything below that area is podiatry. We do the medical and surgical management of the lower leg. Yeah, and you see that actually in Minnesota, it's including hand also. But, in general, we have walked about 75,000 miles by the time we turn 50. On average, we walk 8,000 to 10,000 steps every day. And that accounts to about 4.3 miles per day. And you can look at how much mileage you have put on your feet by doing the 4.3 miles times 367 days and the years of your age. It could be a long calculation, right? Yeah, let's skip that. So how the foot health plays an important role in lifestyle medicine? It's very simple. Dr. Kowalski talked about that already. It just keeps you walking. It's as simple as that. They keep your mobility, and then you can move around and keep your health. So walking is the most popular type of exercise. It's cheap, it's free. You don't need special gear, special clothes, unless you are one of the tribe theme. It's really just free. So when we walk, there are a lot of hormones being produced or reduced. You reduce your cortisol, which is the stress hormone. You reduce endorphin that makes you happy. You also produce epinephrine that's related to your fat metabolism. Serotonin, which Dr. Nelly will talk about next, and your testosterone, which will include related to your fat metabolism, and also your estrogen, which is related to your mood. So so when you walk, the benefit will be to lower your risk of high blood pressure and reduce your blood sugar, especially if you walk after a meal. And it can strengthen your bone, reduce your stress, improve your mood, improve your appetite, and your sleep quality. So Dr. Kosowicz talked about the 6 pillars of the healthy lifestyle. This is according to the American College of Lifestyle Medicine. Local cell foundation, Rogers County also promote another pillar is passion. So we will mention that later. So how walking? So how walking fit into these lifestyle medicine pillars? First of all, nutrition, it improve your appetite, and you also it's a movement, obviously, and you reduce your stress. And social networking is a good time for you to talk with your friends. And sleep, as we mentioned, it improve your sleep quality, and also passion. This is a thing we didn't talk about. We will mention later. And we're going to talk about the most common chronic conditions in the lower extremity. There are three I want to talk about. The first one, we talk about what will affect your lower extremity, chronic conditions. Apparently, the diabetes, the big one, and the weight is another one. Circulation. Someone asked about the smoking. Actually, when you start smoking, in about 15 minutes, your circulation in the lower extremity is affected. So it's how fast you will go. And the effect actually lasts for 2 hours. So sometimes people say, oh, I only smoke like 4 cigarettes or 8 cigarettes a day. But you're talking about 2. That's the entire time, your waking time, the circulation in the lower extremity is being affected. And then the venous and also dementia. People didn't talk about dementia in the feet. A lot of time, because dementia, people started to walk constantly, and they put a lot of stress, pressure on their feet, like that. And the most common condition we'll talk about will be plantar fasciitis, diabetes, and arthritis. Heel pain is probably the most common complaint in the podiatry clinic, probably in the primary care also. Usually it's the plantar fasciitis, or we call it heel pain, or it's a heel spur, and sometimes related to calcaneus or the Achilles tendon. So what is plantar fasciitis? It is inflammation of plantar fascia. Plantar fascia is this big band coming from the heel to all the 5 toes. When it's inflamed, it's called plantar fasciitis. And a lot of times we call it the heel spur because on the X-ray, you can see the spur. It's easier for people to visualize, oh, I got a spur there, that's why I have pain. But it's not really 100% correlated. When you have a heel spur, doesn't mean you have pain. But when you have a pain, doesn't mean you have a spur. But it's just easier to visualize. So we call it heel spur. Plantar fasciitis, we talk about, it's a lower extremity structure, because when we stretch the plantar fascia too much, that's how you have the inflammation. If your structure is not normal, for example, it's high arch or it's too flexible, you stretch the fascia too much, and that's got to the inflammation. And also activity, whether you're just walking or it's running, and your footwear, and also the weight. So when we look at about mechanics, it's the Achilles tendon in the back, and then connected to the calcaneus. And then the calcaneus also have that plantar fascia going to the toes. And that's why the Achilles tendon is very important. And if it's too tight, it also affects the function of the plantar fascia. So the aggregating factors is activities, as I mentioned. Also the weight. So when we walk, it's about your body weight on 1 foot. You think about when you walk, about half of the time you only have weight on 1 foot. So that's the time that all the body weight is on that 1 foot. And if you are running, it could run about 3 times your body weight. And if you're jumping, it could be as high as about 7 times your body weight. And so that means the more weight you have, the more pressure you're putting on your plantar fascia. So the treatment plan is very easy. We look at the structural issue, as I mentioned. If you don't take care of structural issue, it's going to be there. We want to make sure you have enough support in your shoes and your inserts to make sure that you don't have too much pressure on your fascia. But then lifestyle adjustment is a very important one. So I'm going to talk about this based on the pillars of a healthy lifestyle. Nutrition. There are inflammatory diet and anti-inflammatory diet. When you have pain, inflammation, obviously you want to avoid the inflammatory diet. What is inflammatory food? First one, dairy, refined carbohydrates such as sugar. Those will cause inflammation. We want to stop that. And also increase anti-inflammatory foods. What is anti-inflammatory foods? Obviously, it's plant-based fruits, vegetables, especially berries, some healthy nuts, healthy fats, and those are the ones that we promote. Activities, stretching is very important. As I mentioned again, is Achilles tendon. We want to stretch the tendon, make sure we don't restrict the function of the plantar fascia. And stretch management. When you have the cortisol also disrupt the balance between inflammation and anti-inflammation. So we want to make sure that you don't have too much stress, so we can keep your inflammation down. Sleep is very important too. When the tissue repairs happen in a deep sleep stage, Dr. Conversely mentioned, it's not only you go to sleep, but also the quality. You want to make sure you have very deep sleep that for your body to repair. And so, just like he mentioned, but a lot of patients look at me just like, I had a foot pain coming to you. I might expecting some sort of injection, some cortisone, but you are telling me how I eat, just to stress and make sure I sleep well. So, yes, I lost quite a few patients, actually. But, you know, we do what we believe is the best for the patient. So, and then next one I want to talk about is diabetic foot care. It's mentioned about diabetes. Diabetes now the 8th leading cause of death in the U.S. It's surprisingly it's down from 7th. 11% of U.S. population, it's about 37 million people have the diabetes. But then it's 38% has pre-diabetes that they don't know. And so when we talk about the direct cost, it's $44 billion a year. That is just by the medical, medication, everything. And then the total cost is talk about something like loss of productivity, that you cannot work. So if we figure that in, it could be about $100 billion a year, just coming from diabetes alone. And another scary part is that 15% of patients with diabetes, they will develop the foot ulcer in their lifetime, which will commonly lead to amputation. So diabetic foot ulcers, they have a 34% of chance in their lifetime that they will develop a foot ulcer. And 1 in 150 patients with diabetes has an amputation, most commonly coming from the ulcer. So 80% of the 120,000 non-traumatic amputation, meaning that it's not from the car accident or anything, it's just not from the trauma. Every year, 120,000 cases in the U.S., 80% of them are from diabetes. So 50% of people with amputation, they actually undergo further amputation within 2 years. And just the initial new foot ulcer treatment is about $27,000 a year in the first 2 years. So why diabetes causes ulceration and why it doesn't heal? Is first of all, diabetes reduces immunity. And then also, there's something that's called advanced glycation, because there's high concentration of glucose that modify the protein. And this modification affect a lot of tissues. And that's the reason why you check your A1C, because it's modified by the sugar. It's the same thing being modified that affect your blood vessels, your soft tissues, so a lot of tissues right there. And that's why it causes also neuropathy. Neuropathy is not only from the nerve, it could be from the circulation, because the microfiber going to the nerve got compromised, and that's why they have a neuropathy. So what we want to do, we want to avoid that amputation. But then why is so important? When we talk about, it's easy to talk about amputation, but let's talk about mortality, 5-year mortality. When you compare to cancer, because we always talk about cancer, all cancer, 5-year mortality rate is about 26%. Breast cancer is about 10% right there. With the diabetic foot ulcer, the 5-year mortality rate is 26%. It's actually equal to the average cancer. And the charcot foot is the joint deformity because of diabetes. It is the same as having an ulcer. But then when you started to have an amputation, just a toe amputation, the 5-year mortality rate increased to about 47%. But then when you have a critical ischemia, severe compromise of the lower limb circulation is very common in diabetes. As I mentioned, that diabetes, the advanced glycation, they will change the protein and affect your circulation. That the 5-year mortality rate is about more than 50%, about 52% right there. It's the same as a one leg amputation. So the 5-year mortality rate is very high when you start to have that amputation. And anything higher than that is the lung cancer. So it's not only so because of that, diabetic foot care is a big one to prevent the ulcer. We always talk about how to prevent oh, great.
You're supposed to be video?
No, there's no video.
I don't know.
Okay, thank you. There is it. Okay, so when we talk about wound care, to prevent, to heal the wound and to prevent the amputation, we talk about the standard care of wound management. That's from the wound care practice. Is you have to diagnose and manage infection. You have to diagnose and manage the circulation and offload the pressure because the joint deformation, you have a lot of pressure around the ulcer. And you want to promote a good wound healing environment, and you want to keep evaluating the wound. And also, you want to manage the system conditions, not just the wound. The reason I mention is, you look at it, there's a lot of things is the whole person approach, and a lot of things is related to the lifestyle medicine we can do to manage it. I think it's this clicker. Oops. Okay, let's try again. Okay, good. So when we talk about lifestyle medicine approach to diabetic ulcer management, so nutrition, again, we talk about macro and micronutrients. When we heal a wound, you need a lot of proteins, a lot of the protein to have a building block. So we need macronutrients. But at the same time, we don't want to compromise your circulation. When you take the protein, when you think about meat, it has a lot of saturated fat, which will compromise your circulation. So that's why we emphasize on plant-based protein during the wound healing process. You can have soy, beans, or nuts, like that. It give you the protein, but also micronutrient. In the wound healing, collagen is very important, but you need the micronutrient like the copper, the zinc, vitamin C for the proper maturation of the collagens. Without that, even you have proteins, you're not going to properly produce collagen to heal the wounds. So that's why micronutrients is very important. And all of those coming from the plant-based source. And also activities. You want to keep walking as much as possible to keep your circulation. As I mentioned previously, walking is very gentle. It's the easiest way of exercise. keep your circulation, improve your mood, everything. So you want to keep walking. Even when people cannot move their lower extremity, there's still activity we can do with upper body. We don't want to feel people feel like I cannot move, I cannot walk. They just sit there. There's still some exercise we can do to promote the circulation and lift the mood. And stress management, as I mentioned before, stress, the cortisol will affect the inflammation. And also social connection. This is a time they need support. Or when they have a wound, they started to feel like I cannot go out, I'm isolated. And also, one thing people don't usually realize is the wound smells. So a lot of time, the chronic wound patient, not only diabetes, but also any wounds, patients tend not to go out because they have conscious that the wound smells. They don't want people to smell it. That's why there's another reason they stay home. So that's the time they really need support. There's a social connection. Sleep is during the tissue regeneration, healing is from the deep, deep sleep side. Passion, we mentioned about passion. Why you want to do this? Why you want to get over it? The passion is your motivation. You have to think about why I wake up in the morning, why I want to do that. It's a passion. The passion could be, I don't know, some people just crazy about promoting lifestyle medicine, like that. And you need to have a passion. But as simple as, I actually had a patient told me that he found his passion. He was so happy telling me about he found his passion. That's why he started to treat his wounds. He came to see me to treat his wound. I tried to think about what type of grandiose idea he had. But then it turns out he found his passion buying crates of stuff that people didn't want. He just go and beat it, get a crate to home, and open it up, sort it out, and sell it. That was his passion. But that's his passion. I'm fine with that. He's so happy about it, and he's so motivated. Every time he came to me, not only the wound, he's talking about, I just got out of crate. He cannot believe what I found inside. He's so excited. But that is a passion. That's a motivation to keep it going. That is, Dr. Kosawa mentioned the why. That is your passion, your motivation. You have to find your why in you for you to do anything. So that is the passion we also promote. And then comprehensive diabetic foot care, we call it CDFE. That is another thing we want to keep up in preventing the diabetic foot ulcer from happening. And we look at the bone structure, look at the pressure points, look at the skin where there's any pressure, any callus like that. We check the circulation, look at the nerve, and check the footwear, and do the foot imprint to look at the foot pressure as the documentation. How often do we do that? Medicare actually has a guideline there. If circulation is good, nerve is good, do it once a year. If some sort of nerve damage, but circulation is good, we do it every 6 months. If the nerve is then affected, there's a compromised circulation, do it every 3 to 6 months. But if there's any history of ulceration or amputation, it's every 1 to 3 months that we do it. Just keep checking. And at the same time, there's daily foot inspection. Just like people in Texas, you know, when they put their foot inside the boot, they have to shake it to make sure there's no scobian. It's the same here. You know, if you want to check your shoe, you make sure there's nothing inside. We call it, I don't know if people heard about the McDonald's lesion. The grandkids visiting their grandparents with a McDonald's Happy Meals, and they drop the toys inside the shoes. Grandparents step on it, didn't feel it. By the time they found it, there's also the shape of McDonald's Happy Toys, McDonald's lesion. So you have to do the daily inspection, make sure there's nothing inside your shoes, nothing on your foot, and not support cushion in your shoes. And also, now this is the latest one, I just found it last 2 weeks. They have insoles, wireless insoles, put in your shoes and monitor your temperature, monitor moisture, and then the doctors can check it every day. So they can prevent the diabetic foot ulcer. But then my question is, why not we just prevent the diabetes from the beginning? What? Thank you. Maybe I should stop here for that. So we can actually stop, prevent diabetes, and even reverse diabetes. How and why? 20 years later, there's a commercial. Okay, let's talk about arthritis, osteoarthritis. There are 3 types of common arthritis. The first one is septic, which means it's an infection of the joint. The second one is inflammatory, is a lot of inflammation such as rheumatoid or gout. Osteo doesn't mean that there's no inflammation, but it's mostly bone and bone. That's why we call it bone and bone or OH. So I'm going to talk about osteo. Osteo is the most common form of arthritis, especially the knee arthritis. It usually affects about 10% of men and 13% of women ages 60 or older. And most common cause of arthritis is just knee, they say age. Well, we will talk about that. So systemically, female gender is a cause. Obesity, decreased bone density, atherosclerosis, and also gout or just high uric acid level that will lead to knee osteoarthritis. And locally, it's a trauma, repetitive motions, and previous, and also muscle weakness. When you think about the knee, it's a funny joint. It's just two sticks of bones right there. It's all held together by muscles. So when you think about the knee, you really have to think about the muscles, because without the muscle, the knee is not going to hold there. And so, also foot and ankle. People don't think about foot and ankle. You only put a pressure on your knee when you're walking. So, if your foot and ankle is not in a neutral position, a good position, when you walk, you actually translate special forces to your knee at a specific point. So when you look at people who have knee pain, it's not a whole joint. It usually starts on one side. Why is it only one side? And then when people talk about knee pain, usually it's only one side, one knee, not both knees. So when you look at that's why I talk about the age. Now when you have knee pain, right knee, how old is your left knee? If the age is the reason. So it's not just the age, there's some other cause. So when we talk about osteoarthritis management, it's the same. We look at about mechanical issues. For your foot and ankle, whether there's any issue to cause extra pressure at one side or one side of your knee, that we need to correct that. But then we need to adjust the lifestyle. So again, nutrition. Avoid inflammatory food and increase anti-inflammatory foods. What's inflammatory food? Do you remember? Some? Dairy, eggs, fish. Okay. I hate to mention meat, red meat, but okay. What's anti-inflammatory foods? Berries. Good. You're awake. Thank you. Okay. Activity. Here's a bit different. Remember, in the heel pain, we talk about stretching. Here, we talk about strengthening. As I mentioned, it's held by muscles. The muscles have to be strong enough to hold the two bones apart. That's why they don't grind on each other to be bone on bone. And that's why they have to be strong enough. And also they have to be balanced. Otherwise, it left to one side. So that's why we emphasize on strengthening the exercise of lower extremity for the knee osteoarthritis. And stress management is the same cortisol and also sleep to promote tissue healing. Okay, so in conclusion, podiatry and chronic wound care, chronic disease. Chronic disease, disease affect patients in daily podiatry practice. Podiatry allows patients to adopt and maintain a healthy lifestyle. And also, podiatry is frequently the first specialty to notice some chronic diseases because we see patients usually every 2 to 3 months. So it's the first place for us to pick up diabetes and even dementia. Yeah. So, questions? I was told that I had 30 minutes. Turns out I have a lot more time. Okay.
I have a question. So you said, usually people have, problem with one knee. What I've noticed lately, and I started running again, both of my knees hurt.
Well, usually one knee is more painful, but yeah, most of the knee hurt. There's a few things. First of all, running technique is one thing, because there's I don't know whether you heard that there's a forefoot striker, rear foot striker. So there's different techniques. So that could be one thing, how you run. If you both knees, you probably need to look at how you run. And then you know where to find a good physical therapist.
I do. I really do.
If you do, let me know.
Definitely. He's not too far.
Not too far. I can see him actually. Okay, yes, Carrie?
You mentioned soy as sort of a reparative food. Should we limit our intake of soy at all because it's sort of like has some plant-based estrogen properties?
No.
Okay.
So
Good to know.
there are, Dr. Kosovic probably will correct me, and also Dr. Dyson. Okay. I mean, there are actually two different receptors. One is for estrogen, one is plant source estrogen. They are going toward different receptors. So it's actually not going to affect the human estrogen. But because of that, that actually is a protective.
Okay. It's hard to find a straight answer when you try to read about it, because you got people on both sides. But,
No.
I'm talking like soy curls, they're nothing but soy, right? So
Yeah.
it's good to know that I don't have to limit that or tofu.
No.
Okay.
No, they talk about feminized, especially men. And I hate to mention that, but you look at China, Asia, we eat nothing but soy initially, and we have a lot of population there. Yes. Yes.
Yeah, are there times when some kinds of exercises are contraindicated because of the stage of the knees?
Are there times when you should do certain exercises?
Or like you should
Yeah.
Avoid this?
Yes, when it's really painful. What I mean is, you really want to make sure you take care of the structural issue, so you don't work it. If you don't correct your structural issue and you just keep doing exercise, you're going to do more damage. So you really need to take care of that. Just like any heel pain or anything we mentioned here today, you have to look at the structure first. Make sure structural issue is taken care of, so you can, before you do any exercise.
My husband and I belong to a biking club, and we've seen like about half of the people in our club having knee replacements. So I guess I'm always wondering, am I going to be the next one? Do you see that in your practice? Do you see a lot of bikers with issues?
No.
You don't?
Biking actually is very gentle to the knee, because you don't have a lot of stress. the pressure, pumping pressure to the knee. So it actually is pretty gentle for the knee. It's more of when you're not biking. And then when you're not biking, you put the pressure there. But then when the knee is very gentle on the knee, but there's a lot of motion when you do the biking. So if you have any damage to the knee when you bike, you feel more because you're using it a lot. So, okay, you can keep a secret, right? We'll not tell anyone. When you have a knee pain or any most pain on your two legs, the number one reason you can look at it is the legs are different lengths, the limb length discrepancy. That's the number one reason. But then you have to look at why you have that and how to prevent it. But that's the number one reason. Don't tell anyone. There's actually a book just talking about this.
What is the name of the book?
I don't remember.
Okay. We'll find that information for you.
Any questions? Sarah?
Do you work with chiropractic medicine or refer sometimes for certain conditions that you'll maybe pick up in dietary and that maybe chiropractic care could
Number one
address?
I refer to is physical therapy. So chiropractic, they give you relief, but physical therapy is more long term. So I refer to physical therapy. I even refer to massage therapy, like that. Yeah, I do. And then.
I just was brought up on it, kind of piggybacking on what you just asked. As far as like the practice of qigong, the more mellow and slower flowing type of practice. I know I've started doing that. It seems to help my structure.
Yes. Yes.
And that's pretty easy. There's so many YouTube on it, and it's very soothing and meditative. Basically, a moving meditation, I guess.
Yes, it's very good for that. I think we do that every day too, 30 minutes. It's not only for the strengthening, but also for the meditation type. It's moving meditation.
Great for stress management.
Yes. Okay, we're ahead of schedule.
Any other questions? Okay.
Oh,
When you run, should you land on the front part of your foot first and then the heel, or?
and that's why I mentioned to Denise, there's different techniques. It's just like, I hate to say that, different religions, what you believe and what you practice. So, and also related to is a long run or it's a short sprint, so yeah. And that's a good question based on your activity level and how you run and work with your physical therapist. Do you know a good one?
Yes, I do know a good one.
I work out in a gym where they encourage you to exercise barefoot. And really strengthen your feet.
Mm-hmm.
Is that for everybody, or and then there is there are people who run barefoot and where they have shoes that emulate being barefoot. What's your take on that?
I'm not a big fan of barefoot running. Yeah, especially based on your foot structure. But I do agree on barefoot doing the yoga or doing qigong barefoot, and that's a time that increase the sensation on your feet. So that is a good thing, but not the running.
And they're doing strength training. And,
yeah, that's not something I recommend.
yeah.
Yes.
You kind of answered this, but just to be clear, what would you recommend if you knew someone who said, yeah, my knee's been bad, talk to the doctor, and more than likely we'll need a knee replacement,
Well, it's really for the assessment. You want to make sure whether it's really replacement is really needed, and then what can be prevented. The big thing is I also talk about the quality of life. Even you need to have a knee replacement, how do you enjoy your life right now, or how you make a knee replacement more successful? You just want to let it go to the point you need to knee replacement and make the surgeon's job tough, or you want to make sure you can reduce your pain right now, and by the time you really need to do a knee replacement, it's easy job for the surgeon and increase the recovery rate, success rate.
One last question.
Yeah, sorry for reminding us when the barefoot concept came up, is that I'm not sure what that, if I understand large total about that kind of $1,000. Yeah, so I understand, and it's right around that might be because of the foot curling in, and so therefore the toes curling in, and so therefore by being more barefoot, or you can get used to kind of stretching your toes. Can that be naturally healed?
No, when you have a bunion, that means there's a biomechanical issue. And that is another reason you shouldn't be going barefoot because, right, yeah. Okay.
Any other questions for Dr. Lai? Please see him during the break. I know I just got up and my knees creaked and I'm feeling really worried that he's going to look at my shoes and tell me they're not structurally sound. I didn't wear heels. So we have a few minutes that we are going to get up